Hello and welcome to All Things Women's Health. I'm your host, Dr. Chris Stroud. I'm an obstetrician, gynecologist, I'm a father, I'm a grandfather, I'm a small business owner, I'm a Catholic, I'm a lot of things. But right now on this show, I'm your host as we talk about really all things women's health, whether it's childbirth to infertility, pregnancy, loss to menopause, homeschooling to personal trainers, it doesn't matter. If it affects women and their health, it's on our agenda. And joining me today is a delightful mother of two whose story I know that you're going to find fascinating and really unique. Christie Cochran is her name, and Christie's going to share with us her pregnancy and health journey from the perspective of a mother dealing with a chronic illness. In this case, insulin-dependent diabetes, a diagnosis that she received as a young girl. She's going to share with us what it's like to grow up with this serious, often life-limiting condition, but more specifically, the obstacles that she and her husband faced when they were deciding to begin their family. So get comfortable as we get to know a lot more about this young woman and her journey to build a family. We'll be right back with All Things Women's Health. Christie, welcome to All Things Women's Health.
Thank you for having me. I'm excited to be here.
Thanks for having the courage to come on and talk about yourself.
Yeah,
Not
I'm
what
excited.
most people want to do.
Depends on the day.
Right. So you've got a fascinating story. I know that. Our listeners don't yet know that, but they will soon.
Yeah.
And really our theme today is what it's like to live with a chronic illness, but then more specific, what it's like to undergo and plan pregnancy with a chronic illness.
Yeah.
So maybe for perspective, let's roll back to your childhood and talk to us about how you came to find out about this condition.
Yeah. In 2008, so I was 15, I was having a bunch of hunger, thirst, losing weight. And by hunger and thirst, I mean excessive hunger and thirst, losing
Good,
weight.
because my teenagers have that too.
Right.
Yeah.
Excessive hunger and thirst, losing weight, got to blurred vision, starting to have itchy hands and itchy feet, memory fog, just crazy stuff that I was thinking, am I going through a really serious viral illness? And then I just kept getting worse and worse. And we had some friends whose nephew had been diagnosed with type 1 diabetes. And she said, I think you need to have Christie's blood sugar tested. And I actually also at the time had been reading a book that was one of those American Girl Today books that had a story of a girl who had type 1 diabetes. And I told my mom, I think I have this. And she was like, no, honey, and I get it at the time. I'm just thinking this kind of describes me. But a couple weeks after that, I think we had my blood sugar tested by somebody at our church, and the meter just read high. And I don't know if anyone knows, but essentially, if it reads high, there's just it's way, it's way higher than probably 400s at least.
Now, do you remember in that time period, did you have encounters with healthcare providers trying to figure out what was wrong?
No, because we hadn't really gone anywhere yet. It was more like my mom was like, let's give you protein powder to make sure you're gaining weight, and let's make sure we're maintaining your diet, and getting you good, adequate sleep at night. So we were trying all the things at home, and I think we had an appointment scheduled, but it was kind of my friends were like, it's too far out. You need to test your blood sugar now. This is getting drastic. And it was I was going to the bathroom every 5 minutes. I was couldn't stay awake, constantly telling my friends, I'm just so exhausted. And I'm a teenager, so going through things, but not in that level. And my dad, I remember my dad telling me I hugged you and I could feel your ribs, and it was just scary. And so the meter read high, and they said, the lady who had tested my blood sugar said, go to Lutheran Hospital in Fort Wayne immediately. Just go. Don't wait for a doctor's appointment. And it was essentially that night. It was a Sunday night. I was there for several days. I knew. And so
you got admitted as a teenager.
Yes. Yeah, I got admitted immediately. It was one of those I don't even remember the moment that they said you have type 1 diabetes, because it was just I already knew when the meter read high. I already knew before that. And I think some of that was God honestly giving me protection from like this drastic, like I had already prepared. And also I felt so bad that I was really glad to start feeling good.
Sure.
And I didn't know how bad I felt until actually it started the insulin in my body. I remember telling my mom the next morning when I woke up, like, I feel like I have like water back in my cheeks. Like I was so dehydrated and I was just losing like pigment to my skin. Like it was so crazy. So I started to feel like alive again the next day. So learning how to
listening to you as a parent,
yeah.
I think that's every parent's nightmare is that something might actually be wrong.
Yeah.
Is it serious or is it just a paper cut?
Yeah.
And most of the time it's a paper cut. So we as parents tend to minimize. I certainly have done that with my own children, and it turned out to be something more serious, but nothing as serious as this. So that had to be tough on your parents.
Yeah. I think in the moments of realizing that it was an actual diagnosis, it was harder on them than it was on me because I had already come to terms with it in the back of my brain, and they were just now realizing like this is really bad. And also, and we've talked about it since then, but feeling guilty for not thinking of it serious in the beginning, more seriously, which of course I didn't blame them for that. And now as a parent, of course I would do the same, like, oh, you probably just have a cold, and then finding out it's drastic. But yeah, they were awesome in dealing with it with me from then the get-go on and helping me kind of recover.
Now, I mean, maybe you were an exception, but I would make a blanket statement and say most 14, 15-year-old young girls are not the picture of self-confidence at times.
Sure, yeah.
Do you remember what it felt like to get this serious named condition?
Yeah. Interestingly enough, I was so glad to have a diagnosis of something that was medical because I had so many people who I didn't know were actually worried that I was either like anorexic or bulimic at the time.
Sure.
And I was like, guys, I'm eating everything in sight. Like, I'm not. This doesn't have to do with me. It's physical health that I'm struggling with. So to have something that was an illness actually released me from judgment that I felt like I was feeling a little bit later on of people thinking that it was like self-inflicted.
Sort of validating in a sense.
Yeah, it was validating to the struggle leading up to that. And so it definitely in the beginning was hard for me to accept like, oh, I'm going to have to do this for the rest of my life. But the fact that it made me feel so much better, it just became a part of my life. Like I instantly knew that I will feel good when I take insulin for my food.
Wow.
And I did.
So what were the next phases like? You get into the hospital, you get a diagnosis, the mystery solved. Mm-hmm. What happened after that?
It was 2 days of education on like, this is what you need to look for when you're looking for. It was very basic in the beginning, obviously, but like food is going to do this to your blood sugar. Insulin will do this to your blood sugar. You have to make sure you take this amount for this amount of food. And it's trial and error. I mean, there was no blanket in the beginning, like you're all fixed. It was go back to the endocrinologist day after day, week after week to try to figure out what my body required for insulin, because it wasn't just everyone requires this amount of insulin. It was how does your body respond to an apple versus how does that person's body respond to an apple? Yeah. And how does it respond to an apple when you ran a mile before that or when you didn't get a good night's sleep? It's all different.
Now, speaking of that, were you involved in sports?
I was not at the time. I was involved in dance, which it did affect my blood sugar. And I already had felt that because I would have times where I would feel really good after dance because it would help bring my blood sugar down. And I didn't realize that it was doing that.
Wow.
Yeah.
So you learn about this diagnosis. You began to live with it.
Yeah.
What happens after that?
Yeah. Essentially, from there on out, it sounds really silly, I think, for me to say, but it's true. I didn't deal with a dramatic amount of emotion for this diagnosis. I felt bad, I got the diagnosis, and I felt better, and I just chugged on with life. And for some reason, in that time frame, like the time frame before trying to have kids, I remember thinking, like, this affects me, I'll take care of it, I'll handle it, no one else has to worry about it. Not that I didn't want other people to let other people in, but I just wanted to handle it so I didn't bother anyone else. And I didn't realize how much that played into how I would feel as a mother someday, because it affects my children greatly. From the moment I tried to have kids, it affects my family. But I didn't deal with that yet. So I kept thinking, I'm fine. Everything's fine. I deal with my diabetes just fine. Until it slapped me in the face that my diabetes will affect my future family.
Now, I think it's fair to say, I mean, not to pick on diabetics, but I think it's probably fair to say that denial, which is what you're describing to a degree, and diabetes are very common together.
Yeah.
Because it's not something you can see. You don't have a label on that anybody can tell, including you.
Yeah.
And so I know through the years, I've struggled to help patients sort of come to grips with, you can pretend that you don't have this, and there's going to be consequences.
Yeah. And I'm very thankful that I never walked through I'm going to pretend like I don't have this and don't keep myself healthy. But it was, I'm going to pretend like I don't have this and suffer silently while everyone else thinks I'm fine.
Wow.
Again, not knowingly, because I would have said, oh yes, I let people in, but I didn't want to inconvenience anyone with it. Yeah.
How do you think your mother would describe those early years with the disease and the diagnosis?
Yeah, that's interesting. I don't know, because I think I don't know if this has anything to do with the fact that I'm like a firstborn child, but I really tried hard to just like make it my own and let her not have to help me, kind of thing. Which, you know, to a fault, because I would say like there were times that she probably wanted to help me more because she's my mom and she wanted to care for me in those moments, and I was just like, nope, I'm fine. I remember the very first time I took insulin by myself, because she did it for me for a little while, probably several weeks, and she was on the phone with somebody, and I was just like, I'm hungry and I need to take my insulin, and I just remember doing it, and from that moment on no one else ever did it. But it was good for me to have that like take charge moment of it for myself too.
Do you think you would have described yourself, in retrospect anyway, as what I might think of as a strong-willed, independent child?
Yes.
Was that your temperament to begin with?
Yeah. Definitely very like, I wanted to please people as well. So it wasn't like strong-willed in the sense of like, I'm going to like be rebellious, but it was strong-willed as like, I'm going to do this. Yeah. I'm going to take charge of this.
Wow.
Yeah. Which I think plays into my pregnancy journey as well.
Yeah. Well, let's keep moving along the timeline.
Yeah.
What happens after this?
So I would say over the years of being a teenager and early adult with type 1 diabetes, there was just this like constant fear placed in me that I, at the time, obviously wasn't looking to have kids yet. Yeah. But there was a constant fear by every medical professional that I had encountered that someday when you want to have kids, this is going to be hard. You will face infertility, you will face loss, you will face hardship, and you may not be able to do it. And there wasn't ever but you can if you try, or you can because there are healthy diabetics. Yeah. There wasn't that at all placed within me. And so I didn't realize at the time, obviously, that entering into parenthood, I was already fearful. And I'm sure everyone goes into parenthood fearful, but I was
your own unique.
Yes, I was completely fearful.
We should probably pause for listeners that are not familiar with diabetes and point out, your type of diabetes, called type 1 diabetes, sometimes called juvenile onset diabetes because it tends to show itself in young kids, but sometimes even much younger than your diagnosis. But the pancreas is attacked by the immune system. Yeah. And so the special cells called the beta cells, they stop making insulin. Yeah. So you have the complete absence of insulin in its worst form. Yeah. And the issues that you're describing, chronic exposure to very high blood sugar in the absence of insulin causes all of these other problems. Yeah. Kidney disease and heart disease and neurologic disease. And, the most common thing people probably could identify are, problems in the limbs with nerve damage and amputations in the elderly. Yeah. All of those things are very, very common. So I'm sure your caregivers were thinking as they're looking at a 17, 18-year-old, that's the life that's ahead of her. Yeah. She shouldn't even be thinking about pregnancy.
Right. You should just make sure that you can maintain yourself, let alone, maintain other children. Yeah. And I understand that because I didn't know very many people with diabetes, and the people that I knew at the time with diabetes had either type 2 or really, really uncontrolled diabetes, which also played fear in the back of me because I was like, what am I going to do to not be like that? Like, I don't want to lose my limbs. I don't want to die early just because I have this diagnosis. And that, that's something that I'll deal with for the rest of my life because even though I don't have mass amounts of other conditions, that are severe at this point, one autoimmune condition can lead to multiple autoimmune conditions, and I now have more than one. So in the beginning, it was just type 1 diabetes that I was dealing with, and now it's 4 different autoimmune conditions.
That's probably another important point that we should make for listeners is that type 1 diabetes is an autoimmune condition.
Mm-hmm.
And I don't think most people necessarily intuitively think of it that way. They tend to think probably of type 2 diabetes, where you make insulin, you make a lot of insulin. It just doesn't work very well.
Yeah.
So you take medications to make your insulin work better.
Yeah.
But type 1 diabetes is, in fact, an autoimmune disease like lupus or rheumatoid arthritis or something like that, where your immune system is really attacking a part of you, which is a bizarre way to think of it.
Yeah.
That's exactly what it is.
Yeah, which definitely led to, once I learned more about that and learned what autoimmune conditions were, led to basically me having my own fear about my body is attacking itself. So how is my body going to sustain itself to have a baby? Like there's no way. My body can't even make insulin. My body, So it led to the underlying, like, my body is broken. So why would I be able to? I tell people all the time, like, as a woman, you're created to do this. But I didn't necessarily believe that I was, because I was broken.
Wow.
Yeah.
That's profound at any age, but it had to be particularly profound as a young woman, still not mature and sort of emotionally formed.
Yeah.
Do you remember struggling with that identity? And, it sounds like, listening to you, that you felt called to marriage and motherhood early in life.
Definitely.
This must have created sort of a conflict. Maybe I'm not.
Yeah, it's funny because early on it didn't, and I think I don't know if I either just like put my head down and ran with the diagnosis to say, well, this is what I have to do for myself now, or I didn't want to face it until it was time. Either one, and I don't know if it was good or bad, but I didn't have any fear about it leading into motherhood until all of the sudden I had the fear.
Wow.
And it was like, I'm glad that I didn't struggle with fear, leading up to it, because I knew, and maybe this is just the Lord's assurance, I knew that I was called to be a wife and a mom. So I knew that I was going to be a wife and a mom. That's just how it was. I didn't have any fear that I couldn't be, because I knew that I was called to that. Wow. However, I didn't know what that journey was going to look like. And I didn't know how hard it would be, and I didn't know what emotions I would face. And I didn't know at the time then, am I called to biological motherhood?
Sure.
I don't know. I just know I'm called to be a wife and a mom. So we'll see how that goes.
So at some point in this journey, you meet your now husband.
Yes.
Tell us about that.
We actually started dating like 13 years ago this past weekend. And yeah, he's amazing. Luckily, we already knew each other, so I didn't have to like go into a dating relationship saying like, here's an illness that I have. He already knew me just from, we attended church together. We went to church camp together and stuff. And so I'm very thankful that I didn't have to say like, this is something that you have to adjust to learn about me, because it's hard. He just knew, and he kind of just knew how to intuitively take care of me without me having to ask, which is beautiful, because I don't like to ask. I don't like to ask someone to help me, and he knows how to just kind of come alongside me and say like, not like overbearingly, like, are you okay? But like, what can I do for you in this moment? Do you need juice? Do you need this, for low blood sugar or whatever? He's honestly the best person in terms of taking care of me that I could ask to partner alongside of me with it, because he's not overbearing, because overbearing to me gets overwhelming to me, and I shut down. And then I'm like, nope, I don't need any help. And then I try to deal with it on my own. So the fact that he just
it's interesting hearing you describe that, because, in talking with patients through the years, with chronic illnesses, a lot of them will describe in one form or another this concept in their sort of dating years of wanting to say effectively, it's nice to meet you, I'm Christie, I have diabetes.
Yeah.
That it has to define you and define the early parts of your relationships.
Yeah.
You got to skip that.
Yeah.
Because you'd known your soon-to-be husband already.
Yeah, and I'm thankful. I actually remember the very first time when I started a job and thought to myself, these are the first people that I've met that don't already know me. Like, I've met other people, but these are the first people that I'm walking with in daily life in a job that I have to tell now, I'm taking insulin, and this is going to be what you see me do, and I'm not a drug addict, it's scary. And so I was just thankful that I did not have to do that with him, and he already knew, and it was helpful. It was helpful to have that.
So do you feel like those early, maybe premarital and marital conversations about childbearing, do you feel like those were different because of your diabetes, or do you think they were like everyone else's?
Honestly, yeah, they weren't. I'm very thankful. We really just kind of approached it with the same outlook as we would have approached it if I didn't have a chronic illness, because again, we both knew we were called to be parents. So it was just, now there, I will say there were a lot of conversations on, because we knew we wanted to do foster care at some point as well. So it was like, do we start with that and wait to make sure that I'm, perfectly healthy, which again, who can be perfectly healthy before they get pregnant? But do we wait to make sure that everything is good? Or do we jump in with faith, knowing that like God is going to bless this journey as we try? Yeah. And so I think that we navigated the conversation similarly to what we would without, but there was still just fear that was placed in us from every person that I saw, even in those moments of early family planning. Yeah. What are you going to do because you're diabetic, and make sure that you don't have a baby right now?
Sure. Sometimes the intersection of faith and medicine is beautiful.
Yeah.
Sometimes it's not.
Yeah.
So what were you hearing in those early years from those of us in healthcare? Yeah.
Well, early on, it was the people that I was surrounding myself with weren't necessarily people that I chose. These are the people that are going to help me deliver my baby someday. It was just, these are the people that are caring for me right now. So I knew in the moment of like, it's time for us to start looking for our team that's going to care for us as we want to walk into pregnancy. The people I was with are not the people that I wanted to be with, just because they had already instilled fear in me. So I said, all right, before we get pregnant, we're going to look and we're going to find our care team, because I have to make sure that I'm comfortable with the people that are caring for me before I can even think about bringing another life into this world.
And that's not, I think it's fair to say, that's not a usual internal conversation that takes place.
No.
Now, it probably should be.
Yeah, for sure.
But you were in a unique position. So it's fair to say you took a very proactive approach to getting pre-pregnancy care, you might say.
Yeah. And I think a lot of that, even though it wasn't great, a lot of it was because I had walked in so much fear that I wanted to make sure I wasn't fearful with the people who were caring for me. And I actually didn't know if there was anyone out there that would make me feel that way. I thought, well, I'll just look and I'll go through my options and I'll see if there are people that will make me feel calm and comfortable about this. We are already several months into trying to get pregnant, and so we were already walking in that fear of like, are we going to be able to do this? When we started essentially like, I say interviewing, and it wasn't really, it was just going to appointments with providers saying like, I'm type 1 diabetic. What would you do for me? Like, how would you care for me? Yeah. And I had planned on seeing 3 different people, and you were the first one I saw. And it's really interesting because I've told this story to so many people, but never with you across from me. But it was a life-changing moment because you were the first medical professional to tell me that I could do it.
Wow.
Very first. So to walk out of your office feeling like I have the capability to care for myself and have a healthy pregnancy with this illness. Yeah. It was just not told to me. And I don't blame the other people for not telling that to me, because I understand that they were also looking out for me, and they were trying to create this like awareness of the illness that I had, but I was already aware. And I wanted to sometimes say like, I know, guys, like, don't keep placing this fear in me. I need you to lift me up and build me up and say that I can do this. I
remember in medical training at some point through the years, listening to other people have that conversation. Yeah. And it always it always reminded me of sort of this goofy analogy of someone is sitting in front of a physician who doesn't have legs, and they say, well, I want to run a marathon. And the physician says, well, you don't have legs. Well, of course they know they don't have legs. You're not going to tell them something they don't know.
Right.
And that's what I sort of hear from your story, too. Yeah. You were just looking for somebody to understand that you understood your condition.
Yeah. I understood what it would take for me to walk through that. Yeah. But I didn't have anyone to walk through it with me. Like, it was like, I understood, but everyone was also too scared to walk through it. Yeah. It was like medical providers themselves were like, yep, don't do it.
What I remember about you is sometimes as a physician, you'll meet someone with a serious illness that is very clearly living in denial of that. And maybe, I'm not sure denial is the right word, but they've put it in a place in their brain where they've just sort of decided it's not relevant. And that can be really challenging. Yeah. But I distinctly remember meeting you and feeling like you're not in denial of your condition. If anything, you're in complete and total control. And that I remember being so sort of stricken with this feeling of, you've got your diabetes, it doesn't have you.
Yeah.
And I don't remember meeting many, particularly young people. I don't remember meeting many like that.
Yeah. I remember you saying that too, because you were like, yeah, I think that I have confidence in you because you have confidence in you. And I was like, well, I'm glad that you feel that way, because I didn't necessarily feel like I had that confidence.
Yeah.
But I had walked out this assurance that, again, I don't want that diagnosis to like define me, but it makes me who I am. I have everything that I have now is because I've walked paths that have gotten me to where I am because of the diabetes. Honestly, like it's shaped my whole health. It's shaped my career. It's shaped everything, which is, it's humbling.
So we started doing some things.
Yes. Yeah.
Walk listeners through what those next few months were like.
Yeah. Well, so it took us 6 months still after that to get pregnant. But you had said, like, essentially, we'll see you in a year at the mark of not being pregnant, or we'll see you before then pregnant. And it was right before that year mark that I ended up getting pregnant. It's actually kind of fun. I ended up with a kidney stone. This is not fun, but and the way I found out is they went in to do an ultrasound and x-ray to see if my kidney stone had been gone, had passed. And she said, is there a chance you might be pregnant? And I was like, well, yeah, but like, no. Because at this point we had been trying for a year.
Sure.
And she came back in the room and said, you're pregnant. And I just immediately was like, I had no idea. I started crying. I wish my husband was with me at that moment, because he wasn't. But that was just a beautiful, like, light surrounding this whole, like, another illness thing that I had walking through kidney stones and stuff like that. And immediately I was just like, oh my gosh, like I had already been walking through like tight control of my blood sugars prior to that. Right. Because preconception is even more crucial, which I don't think that's talked about a lot either. And so I tried really hard to make sure my preconception numbers were controlled and everything was good. But honestly, I had lived most of my life trying to make sure that everything was controlled. And I'm not to say that that's because I'm doing a great job. I think some of that is just truly out of fear.
Yeah. And I think with diabetes in particular, but a lot of chronic illnesses, the desire for pregnancy can become a huge motivator.
Yeah, for sure.
And for listeners, the success of pregnancy, whether it's birth defects or just outcomes in general, is directly related to how good the diabetes is being managed on the day of conception.
Yes, exactly.
And the months leading up to that.
Yeah.
So you were working on that, but you didn't have much to do.
Right.
And then you find out you're pregnant.
Yeah.
Do you remember if there was a sense of fear at all of, oh no, what have I done?
Yeah, it wasn't a fear of what have we done, but will this really happen? Yeah. I'm pregnant, and so that part worked. But will the rest of it work? Yeah. And I just had to continually, every day, just trust that God has a plan, and he wanted me to be pregnant. And for however long that was, I wanted to walk through that with grace. And that was terrifying, because I truly did have the fear still in the back of my brain that every day it was going to end, because that was what was told to me. So
you'll have miscarriages, you'll have preterm labor, there'll be birth defects.
Yes, you'll develop all of these other things, preeclampsia, all of these other things that are going to happen to you that never happened, that I kept just waiting day after day for, God to lead me through it all, as scary as it was.
It's a tricky thing in medicine, because people can say things that are factually correct, but convey them in a way that it has a radically different meaning than if conveyed in a different way.
Yeah,
sure. I mean, thinking about your situation, to say that you could have a miscarriage, that's factually correct.
Sure, yeah.
But to convey that I think you're going to have a miscarriage, so don't get excited.
Yeah.
I think that's almost criminal to do that to somebody's heart.
Yeah.
It's almost as though when you say goodbye to somebody and they get in their car, and at the end of the driveway you say, well, you could get killed.
Right.
Most of us don't do that.
Right.
But in medicine, too many of us do that too often.
Yeah.
Instead of looking for the half full glass, we look for the half empty.
Yeah, and that definitely does not play a part in championing anyone to move forward with confidence in themselves at all. Yeah.
So I don't recall, but let's pause and talk about technology a little bit.
Yeah, yeah.
In that first pregnancy, did you have an insulin pump?
I did not. No.
Or a continuous monitor?
No, I didn't have anything yet. I just had a blood sugar monitor that I would prick my finger with.
4+ times a day.
Yeah, it ended up being about 12 times a day in the beginning because I was so paranoid. And insulin injections with a needle. And so I, in the very beginning, which now having a pump and a continuous blood sugar monitor, I'm like, how did I do that?
Yeah.
Oh my word. But I did that all the way through my first pregnancy. Halfway through my first pregnancy, I got a continuous blood sugar monitor.
Yeah.
I was waiting to be approved for that. And I think being pregnant actually helped me become approved for that, which was wonderful. That was life-changing. To be able to see my blood sugar constantly, I'll never go back. Like, I cannot imagine not knowing what my blood sugar is at any moment.
Yeah.
But I actually did not have an insulin pump until after both of my pregnancies.
Yeah.
So I'm here now thinking like, oh my word, how much easier would it be with a
The technology has so radically changed
Yeah.
the way an insulin-dependent diabetic can live.
Yeah.
And live well.
Yeah.
That it's hard for me because I've spent more of my career pre-diabetic technology than post-diabetic technology. But it's hard to remember what we used to do. And the management was just not as good. You were up and down and up and down. That's not good for pregnancy. That's not good for life.
No, yeah.
But yet, part of the amazing part of your story is you did so well even without the technology.
Yeah. Yeah. And that is funny because there are a lot of times where I feel very weak with this illness. But that, looking back, makes me feel very strong because I'm like, the fact that I was able to manage my blood sugar well without the technology is insane to me because even now with the technology, sometimes it's hard, you know? So I'm like, that is crazy. But that's just how dedicated that I was to trying to make sure that everything went as well as it could possibly go.
How did you deal with what I think universally experienced by most pregnant women, food cravings?
Yeah.
Because for you, that's a big deal. What kind of cravings did you have and how did you cope with that?
Interestingly enough, I didn't have any that necessarily were dramatic in the sense of affecting my blood sugar, except for the opposite way, like at food aversions, where I would feel like my blood sugar was constantly plummeting because I wasn't eating enough. And not only was I not eating the amount that I should have been for a normal person, but a pregnant person, like I should have increased that.
Yeah.
Especially in my second pregnancy. My first, I was not very sick at all. And I'm very thankful because I was able to walk through that with pretty much just tight control of diabetes, not dealing with a ton of morning sickness or anything. But in my second, I dealt with a lot of morning sickness, a lot of ups and downs of mental health as well, because I struggled with, is this just hard for me because it's my second child? Does everyone walk through this? Or is this hard for me because I have a chronic illness? Or, am I worse this time than I was last time?
Yeah.
Can I do it?
It's hard, I think, for most people to appreciate that for the insulin-dependent diabetic, nausea and vomiting can be life-threatening.
Yeah.
If you've taken your insulin and you can't keep food down, you could find yourself in an insulin-induced coma pretty quickly.
Yeah.
So then it becomes more than just food aversion.
Yeah.
You have to put some food in.
Yeah.
That can be challenging.
Yeah, that played a lot of roles of fear within me. And again, definitely through my second. So my first pregnancy, I had the normal fears with what would happen at the end, but the second pregnancy, I just constantly, I remember multiple times sitting cross-legged on my kitchen floor crying while sipping juice because I thought, if I throw this up, I might pass out and no one will find me. And I have a baby. Now I had a second, or a first child walking around. And so the fear of how can I make sure that I'm not only thriving, but just surviving this was terrifying. It was terrifying.
Let's back up a little to your first birth.
Yeah.
So you go through pregnancy. It goes really remarkably well, you might say.
Yeah.
What were your feelings as you sort of think about the end of the pregnancy? Because we beat you up pretty good with all of the testing and all of the monitoring.
Yeah.
Help people understand what that was like.
Yeah. So lots of testing. I went through, I was probably in the office 2 or 3 times a week towards the end. Non-stress tests to monitor baby's heart rate. And you probably know how to explain those more, and biophysical ultrasounds to make sure the amniotic fluid is good and baby's responding and breathing and
because
growing.
Listeners, the challenge, one of the many challenges with an insulin-dependent diabetic is the risk of stillbirth.
Yeah, yeah.
And I'm old enough to remember 34, 35 weeks, we used to deliver those babies because the risk of stillbirth would climb so rapidly that while they were premature, it was worth the risk of the prematurity because the risk of stillbirth is so great. Now we've gotten much better at that, but the way we've gotten better at that is what you're describing, the essentially living in our office with every other day testing to constantly say, is the baby okay? Can we go another day?
And the can we go another day thing was very also, I was also fearful because every time I came in, it was, is this going to be the day where they say something's wrong? You know, is this going to be the day where we choose the baby's better outside of me than inside? And it's funny because I had a lot of friends telling me, man, I just remember towards the end feeling that like, oh, I'm a little bit nervous because the baby outside of me isn't as safe as the baby inside. And I was like, I don't relate to that at all. Like, as soon as I hold that baby in my arms, I'm going to say, I now no longer affect their health. Now I do because I'm their mother. But everything I ate.
But what a bizarre reversal of
the
usual feelings.
Which definitely caused a lot of fear towards the last few weeks. Everything I would eat, I would be watching my blood sugar to make sure it didn't go up, and I would be fearful that like how much. I didn't know enough then to know how much high blood sugar is going to cause an issue. Is it one spike or is it riding high for hours? I was fearful of that.
So, what were your feelings about your vision for how you wanted your labor and birth to go in that first pregnancy?
I think it's important to go back and just say, too, that another reason why it was so awesome to come into your practice is because before that, I had been told essentially, like, you'll probably have a C-section at 37 weeks.
Right.
And I was like, why? Like, why would I just blanketly be given a C-section? Because that's quite the opposite of what I wanted. I wanted the most natural experience I could get, knowing that I was insulin-dependent diabetic, so knowing that it probably wasn't the case for me to have the most natural, but knowing that I was capable of it, knowing that I could if I kept my blood sugars controlled, and there wasn't going to be a medical indication that I would need a C-section, why would we just do that?
Where do you think that desire that you have /had for as natural as possible birth, where do you think you got that? What gave you that sense?
I would say probably first and foremost my mom. She had my brother and I in the hospital, but then she had my sister at home. And so knowing that she was able to do, things totally naturally, kind of just like there's an empowerment to that, to feel like you're entering into motherhood, doing it all on your own. And so the feeling of having that taken away from me for some reason just felt wrong. Like, not because if there was medical indication, I wouldn't want that, but because if there wasn't, then why would you take that from me? Like, if there is no reason, and I've worked my butt off this whole pregnancy to make sure that everything is good, then why all of a sudden would it not be just because we're afraid? And so that was really challenging for me to walk through when multiple providers prior to meeting you were just like, this is going to be dangerous and we'll have to give you a C-section. And I was like, oh my gosh, I don't know why that would be the case.
But you point out a very profound yet subtle difference. And I think of it when you say, if there was no reason to do these things, I didn't want them done. That's a distinct difference from saying, I don't want them done, I don't care. And I think a lot of providers hear the latter regardless. They just hear someone saying, I don't have diabetes, I'll be fine. Right. I don't want these things. That was not you. You were not that. But you took a very reasonable position, which is, just tell me, just show me. But if it's absent, it's absent.
Right.
And that's unique, I would say, particularly for a first-time mom.
I think because I'm so aware of the to go back to my mother, my mom, she likes to do everything all natural. We didn't have tons of antibiotics. We weren't in doctor's offices all the time. We were just super healthy and did a bunch of natural stuff. So the fact that we came from that, yet I'm alive because of modern medicine, really is humbling. Because it creates this huge swirl of I obviously know that modern medicine is so crucial to certain situations, yet that doesn't mean that we have to just jump into it completely. Just because I was diabetic doesn't mean I just embrace all medicine. I'm insulin dependent and I take insulin artificially every day to stay alive, but that doesn't mean I just say now everything about me is ruined and I can't do anything naturally. I do everything else naturally.
Yeah.
So I tried that for, pregnancy and birth too.
Said differently, your pancreas doesn't work well,
Right.
but your brain is just fine.
Yeah, exactly. Yeah. Pancreas is dead, but
Interesting.
yeah.
So you have this vision for your labor and your birth.
Yeah.
And you enter into that.
Yeah.
Walk us through that.
Yeah, genuinely hoping, because even though I knew at some point it may come to we may come to the decision that being induced is probably the best for the safety. And knowing that I may get to that point, still hoping that I would just naturally go into labor before that moment, because I wanted the feeling of naturally going into labor.
Right.
And so honestly, I will say to this day, one of the hardest moments was my first induction, which is very interesting because nothing actually went wrong. It wasn't really a crazy traumatic experience, but I remember them starting the induction process. Well, let me back up. We had talked about how long can we make it, essentially like how far can we go? We don't really want to go past 39 weeks because of the risk, but I was in the appointments every week, everything looks good. See you next time. Everything looks good. See you next time. And I remember the moment that I was in the office and I all of a sudden was like, everything is not good. Like my blood sugar was just continually rising and I couldn't keep it down. And that was the moment for me where I was thinking, I've lost control of what I've been able to do in this pregnancy. And I don't, as a first-time parent, know how much is okay for me to push from here on out. I don't know how much I can say, no, everything is fine, because I don't know. I'm just a human.
And that was radically different for your entire medical history.
Yeah.
Because you had been so tightly controlled.
Yeah.
You'd been beating the disease nicely.
Yeah.
And then that represented a change.
Yeah. For it to shift and me completely not be able to control it whatsoever. And no matter what I would do, I was in, 48 hours of gnawing on carrots, thinking I can't eat anything else because my blood sugar will go up and my baby will die. I mean, truly, there was so much fear there. So when I came into that appointment on that Friday, that was supposed to be then a week away from my induction, I had said, I'm not doing well because I'm a little bit nervous. And I remember the nurse said, I'm going to go talk to Dr. Stroud. And she came back and said, Dr. Stroud said, I'm not worried about Christina, but if she's worried about her, then I'm worried about her. And I was like, okay. So we talked about moving the induction up. It was really just a matter of days that we moved it up. But at that moment, it was just in my brain. It was time, because I had known that we had pushed it as far as I felt like I was comfortable going for that pregnancy. And I didn't know what I didn't know. And I wanted to make sure my baby was safe.
Now, it put you in a really unique position. And I think a lot of women find themselves in a similar position, even without diabetes specifically. And when I say that, I mean you had a clear-cut reason to be induced. That wasn't really debatable. And you had very strongly held opinions and views and a vision as to how you wanted your labor to go.
Yeah.
So how do those two things come together? How did that work?
Yeah. Interestingly enough, I have worked through for years some slight anger with God. Because
You too, huh?
Yes. I still, even though we had the induction sent, went in thinking, but I'll just go into labor the night before. I'll go into labor hours before we make it in, because God knows that I want to go into natural labor and I've been doing everything right. So he will give me this gift. And so I think that set me up for failure in the moment of I'm on the bed being hooked up to the induction tools. They're doing the paperwork and I'm just sobbing. And my husband said, what's wrong? And I said, I don't want to be here. I don't want to do this. And he was like, wait, he's so confused, what, but we're doing this. And I said, I just thought I was going to go into labor. And I truly did not ever wrap my brain around being induced, because I kept holding on to the hope that I would push it far enough that my body would just take over and do it.
Of course.
So even though I made the decision and there was medical indication, I still struggled for years with the idea that my body still didn't do what it was supposed to do, because I still needed help.
That same old story from since you were 14.
Yes.
Right. My body's broken.
Yeah. And I had to really kind of wrap my brain around the fact that just because, and I'm now even just working on this, just because my body itself has failed me doesn't mean I am a broken human, because every day I take insulin. So I could say to myself every day, I'm broken. I'm not living this life. I'm not. My insulin is keeping me alive. But that doesn't mean that I didn't birth my baby. That doesn't mean I didn't work really hard to get my baby into this world. And just because I had that and I had to deal with the emotions of not feeling like my body was capable of doing it, my body was still capable of doing it. It just needed a little bit of help, just like the insulin helps me stay alive.
So I think there's two paths, two common pathways there. And for a woman in that position, she says, well, I have to be induced. They convince me of that. So it's over. I'll just lay here and hopefully the baby comes out of me.
Right.
And if not, they'll cut it out of me.
Yeah.
So they just completely abandon all desire to achieve the birth that they wanted.
Yeah.
And then the other path is, okay, I have to be induced, but I'm not giving up.
Yeah.
I'm going to make the most out of this.
Yeah.
You chose the latter. But help listeners understand how you chose the latter and what that was like.
Yeah. So I'm thankful again that we were able to have your care team to sort of help me champion the like caring for my own blood sugar, because sometimes hospitals will be a little bit hands-on and say like, we need to make sure we're managing your diabetes for you. And I was like, whoa. I've managed my diabetes up until this point. I'm not ready to give it over to you. So my husband and I essentially were just on a team of like, every time the nurse would look at him and say blood sugar, he would tell me what it was. If it was a little bit low, I'd have like a bite of Jell-O. Like we would just, and I ate other food too, but like essentially just to sort of like manage it the entire time. And I just thank God to this day, like my blood sugar was literally in perfect range for the entire 48 hours of induction until the baby was there. And it was a beautiful, like, even though I was struggling with the induction experience, it was a beautiful experience. And I was able to be like happy and healthy and whole bringing my baby into this world. And she had perfect blood sugar. She did not have to go to the NICU. I remember the doctor telling me that there was no calcification on my placenta. So there was like no issue with any sort of, indications of things going wrong. And so I was just like, even though I was kind of like beaten down in the beginning, I was like, super proud leaving that, thinking we did it, everyone's healthy.
And then you did it again.
Yes. And I would for sure say that, crazy enough, the second time around the pregnancy was exponentially harder because of that mental struggle with am I going to be able to do this? Now I have another life depending on me, and I'm walking through this. And I don't know if I'm going to pass out in my kitchen because I'm throwing up. And I don't know if I can go through, the hope of not going into labor again, because I still was hoping this time I'll go into labor. And I actually hired a birth doula for my second pregnancy, and am now a birth doula because, and I would say like one, in part for you championing women to just be empowered as they walk through their pregnancy journeys. And I wanted to walk alongside other moms during that. I wanted to make sure that they knew, even if they didn't have a provider that was necessarily doing that for them, that they could either find one or they could still do it on their own, specifically with a chronic illness or high-risk diagnosis. So I hired a doula for my second, and it was just life-changing to be able to have – I still had an induction. We pushed it out farther even than we did the time before, and it was awesome, but it was so much more of a natural induction experience. I know that sounds silly because induction is not natural, but I had a lot more control over the situation. And I know a lot of times people talk about like perceived trauma and how essentially even if your experience is good, the lack of control can make someone feel like it was traumatic. And so more things actually quote unquote went wrong during my second than my first did. But if I look at both of them, I would say my first was more traumatic than my second, just because of how I felt. I felt out of control of my first experience because I was just like, well, this is happening to me and we're just going to have this baby. Whereas the second time, every single time we were doing something, I was breathing through it. I knew what was happening. I knew, and I was a second-time parent, so I knew what to expect. But I knew this is what's going to happen if we break my water. Let's wait 4 hours. Let's make sure that I'm contracting a little bit more on my own first. So we did, and it still took a long time, but we did as much natural as we could.
How do you feel like your own obstetrical experiences influence your practice as a birth doula?
Yeah. I would say I would say part of it is hard for me because I have to walk through my own fears as I'm walking alongside of people. Not my own fears of what will happen to them, but my own fears of like if I see something, will that happen to me if I try to do this again? Or are they feeling the same things I felt in this moment? Because I don't ever want to put on them feelings that they don't feel. So we talk a lot, especially if I have someone with a high-risk illness, we talk a lot about their perception of their illness and how it feels to them. Because if they don't have any like medical past trauma, I'm not going to give them my medical trauma. You know what I mean? Like, I don't want to make them feel like, oh, your body's broken because, but if they feel that way, then I want to come alongside of them and say, it's not. And here's how I can help you feel like it's not, because I worked through this too. So it's interesting because as I work with people who are just very low risk and have all natural experiences, I think that some would think I would feel negatively towards that. And I just don't, because I know that my role in their journey is completely different than what my role in a journey of a high-risk pregnancy, specifically even a type 1 diabetic. I've had the pleasure of supporting 3 type 1 diabetics, and it's just been wonderful to be able to walk through that and have them look at me and me look at them, and we just know she's worried about her blood sugar and her baby, and I'm worried about her blood sugar and her baby, so much so that we're both crying because we both get it. And there's a certain level of getting it that nobody else gets. And so that helps.
It seems to me that your issues are unique on the one hand. On the other hand, they're actually pretty universal. If you and I know you've seen this with non-high risk and high risk laboring moms as a doula, but they're really the same issues, aren't they? It's fear. It's a fear of lack of control. It's a fear of is it possible for me to do this and survive? And those are universal feelings. Your medical condition made it maybe a degree more interesting or unique, but yet at the same time, the trauma comes from not dealing well with those fears. And you did so beautifully. And you do so beautifully at helping other women do that as a doula.
I definitely want, like, that's essentially my goal for anyone that I come across, even if it's not a client of mine, but just like a diabetic themselves who's walking through, or just someone who doesn't have, the feeling of empowerment moving forward with trying to get pregnant, to educate themselves prior to getting pregnant, to know that they can work through some of that fear before they're faced with the fear, and to understand that, like, you have more control than you think you have more options than you think you have care teams that will come alongside you and make you feel like you can do this, and you don't have to just be put in a box of chronic illness that you feel like you're placed into, because you can definitely feel most days like you're put into a box that, because this is your lot in life, this is what the rest of your life will look like, and you can't break out of that or thrive.
Maybe specific to that subset of women who have a chronic illness, diabetes or otherwise, how would you advise them to go about finding that right kind of care team? What does that look like?
I definitely would say have prenatal appointments with them. Before you're pregnant, go and talk to doctors.
Pre-pregnancy.
Pre-pregnancy. Go talk to doctors and say, how would you care for me? What is your feeling about type 1 diabetes in pregnancy and birth? Do you feel like it's a safe thing, or do they have their own fears? Because if the doctor has their own fear, that's going to portray fear on you. And so I honestly too, just like I'm a huge believer in like your intuition and your gut feelings and how the Holy Spirit leads you in a moment, and to know that you feel like it wasn't necessarily that you said anything profound in that appointment. You said you can do this.
That's because I never say anything profound.
You said you can do this. You can do this. But it was the feeling that I knew I was safe and cared for and confident. And I just walked out knowing that feeling. And I think that you can have that feeling, and it can be different for different people. I know that people have providers that they feel that with that I don't feel that with. And that's good for them because they've had conversations that have made them feel safe.
A question or a tool that I like, and it's not unique to high-risk pregnancies, but to say, these are the things that are important to me. Have you ever cared for someone that had these things that were important to them? And if so, tell me about it. And if you get the proverbial eye roll, you're probably in the wrong place.
Yeah.
Because you've said, this is the universe of things that are important to me.
Yeah.
If the other person is essentially saying, well, those aren't important to me, that relationship's not going to be fruitful.
Yeah.
And I think you make a great point. It's going to be different for every single person.
Yeah. Which is hard for me to wrap my brain around because, of course, when I think, like, these are the people that help me, I'm thinking, these are the people that are going to help everyone. But I have to remember that everyone's experience is completely different, and they have different feelings, and they also had a different background. Just because they're type 1 diabetic doesn't mean they have the same feelings about their diabetes or had the same care from their diabetes growing up or had the same issues with doctors. And so to kind of just like meet them where they're at and say, I've experienced this stuff and I can help you walk alongside of that, or whatever other feelings that you're feeling, because I know that you're feeling, you know, a sense of unknown. You're feeling a sense of unknown moving into it, as anyone would with a pregnancy, but the blood sugar management part is just so overwhelming. And it's overwhelming in motherhood too. I mean, you continue to then say, I am sacrificing time with my kids, time with my, you know, significant other to make sure that my blood sugar is managed. And that's hard.
I know there is a young woman listening who has a chronic medical condition, maybe insulin-dependent diabetes, who's sort of thinking, I don't know, maybe I'm broken. What do you say to her? What's the takeaway for young women who desire pregnancy as you did, but are struggling with a chronic illness?
Yeah. I would just say, first and foremost, obviously remember that you, just because you have a broken part of your body does not mean you're broken as a whole. And that just because that piece is broken doesn't mean the rest of you is weak. It actually makes the rest of you stronger. It makes you more in tune with that portion of your body. I feel like I'm in tune with my body so well because I have to be, because I'm my own pancreas. And so walk through that knowing that you've been given, it's hard. It's super hard to have this outlook, but you've been given a gift that you know more about your body. Not everyone knows all this about their blood sugar. I know so much about my body, and I've been given that gift, and I'm thankful that other people are also given that gift. That even though it may seem like a curse, like, use it as a blessing. It's something that you've been given that you can in turn eventually walk alongside of someone else with. When you feel like you're at the point where you're championing it, you can walk alongside someone who doesn't feel that. And so look into the little pieces that it's given you. The chronic illness has given you friends that you may not have, given you opportunities that you may not have, given you outlook on life that you may not have, given you feelings and emotions that you may not have dealt with just because you're dealing with them because of your chronic illness. And do research too. I mean, like, look into it, because don't just take blanket statement. If I would have taken the blanket statement, I would have had a C-section at 37 weeks. And I wouldn't have looked into what it would have been like to be empowered into this experience of, I can do this. I can move forward with health and thriving in pregnancy, and knowing that there's even more for me than what we have, you know, like, even the next time it could be better. I could still go into natural labor. I just think there's so much more than people limit themselves because they feel like they're put in that box, and they feel like they're put in that box for a reason, because I know the feeling of feeling like you're in that box, because the box feels a little bit safer than breaking out of the box. Breaking out of the box is a little bit scary, but it's definitely more empowering.
Well, I think the fact that you could sit here with us and describe juvenile onset insulin-dependent diabetes as a gift, I think that's probably the gift in its own right.
Yeah, I'm definitely thankful.
Mothers that are interested in you or someone like you as a supportive birth doula, how do they find someone like you?
Yeah. Well, there's plenty of organizations out there that you can go to kind of like interview your own birth doula as well, because I would say that's something that's huge too. Like, just because I have the past of that kind of chronic illness that I can walk through with someone, that doesn't mean I'm necessarily going to be the best fit for you as a doula. But if you want to look into interviewing doulas, there are like meet your doula organizations. You can like sort of interview them and see if they're a good fit for you. And I would say, making sure that that person also recognizes what your wants and your needs are for your birth, and that they're available and capable of like helping you be empowered walking into that birth experience. But interviewing, for sure, making sure that they're the right fit, because you can have someone that's not the right fit, and that doesn't make it a good experience.
And specifically, how could listeners contact you for your services?
Yes. Birthing You Doula is my name, because I feel like as a mother as a baby is born, so too is a mother. And so the experience is you being birthed into motherhood. So birthing-you.com, and then at birthing.you doula, I think, on Instagram. I'm trying to remember the name of it for sure, but yeah, on Instagram. So Facebook, Instagram, website. And I'm also a birth photographer along with that, so I take pictures of the experiences as well.
We may have to come back and do another episode just on photography.
Yeah, it's beautiful. It's a wonderful
Thanks
experience.
for sharing your amazing story.
Thank you. Thanks so much for having me.
Well, listeners, I hope you've enjoyed the story of this journey as much as I have. Do you have a chronic illness? Maybe you have endometriosis. Maybe you have lupus. Maybe you've got insulin-dependent diabetes like my guest. Do you feel like it defines you at times? A lot of women would say yes. But I hope, if nothing else, from listening to this amazing young woman, that you realize there is much more to you than a diagnosis. As a woman, you are fearfully and wonderfully made. You're a daughter of the King. Don't let a diagnosis rob you of a moment of that joy. Well, do you have a story that you'd like to share with us? A story like Christie's, or a very unique, completely different story? We'd love to hear from you. You can contact me directly, 260-450-8878. I'd love to hear your story, and we'd love a chance to tell it. A special thank you to our friends here at Spoke Street Media, without whom this podcast would be impossible. You can hear an amazing collection of content at spokestreet.com, so please check them out. Well, thank you again for joining us here at All Things Women's Health. I'll be back with another episode, and until then, thank you for joining us. Please like and subscribe, and get your friends to listen to us as well. I'm your host, Dr. Chris Stroud.